Good morning, it's Dr. Larson here to talk about COVID-19. Welcome to 2021. 2021 will be better, so that is a promise. We are continuing to have high numbers of cases of COVID-19, and actually this morning we had 3 new patients admitted to the hospital with COVID-19. So not just numbers going up, but numbers of people in the hospital going up. So we expect those numbers to continue to go up for a little while based upon the Christmas and New Year's holidays. So my ask to you would be, if you went somewhere and were with a large group of people for either the Christmas holiday or the New Year's holiday, consider that you were exposed. It's now been 4 days since the New Year's holiday. It's been over 10 days since Christmas. Please consider going out and getting tested. The COVID clinic is open 7 days a week, 9 to 5. There is no current charge for COVID testing. So for those of you that don't have health insurance, there's no charge. The insurance companies are still waiving copays and deductibles, so it won't cost you anything to be tested, and please look out for your neighbors and consider being tested. Our current incident rate is 554. That's up from 455. Again, the recommended incident rate for moving into phase 3, which we did in the summer, was less than 25 cases per 100,000 per 14 days. Our percent positive rate increased from 13.1 to 15.8 this week. One of the metrics we're going to be looking at going forward in 2021 is we want that number less than 10%. So the percent positive, we want less than 10%. So we're not quite there yet. We continue to have, as I noted, patients in the hospital with COVID-19. We've had a few deaths recently in the community of members of our community that had COVID-19, so make sure to check in with your neighbors. Schools are back in session as of yesterday. All K through 12 schools in hybrid model only. They are doing testing. They are offering testing to all faculty and staff, as well as students who are sick. So we're using rapid antigen testing for those, and our goal is to keep K through 12 education going forward. We may actually be able to even expand that moving forward if we continue to do those things that we know work: social distancing, masking, and not getting together in large groups. The governor did continue his restrictions until next Monday, January 11th, and so we'll see what happens after that. But currently the recommendation is stay in your bubble, stay within your small groups, don't do things inside. Doing things outside, like going for a hike, going skiing, those type of things, running, those things are totally fine, but indoor activities are at high risk. So we have started immunizations in our county. We've gotten through most of the 1A group. The state is working on 1B, 1C lists. Those I would expect to come out later this week, that the people that are going to be on those lists, we still need to get vaccine for those folks, but we should have at least some direction as to where to go. There is a vaccine finder website on the state level that was kind of rolled out last week. But if you are going to be one of those people in the groups that are at higher risk, we will communicate with you from the health department via press releases and those kind of things, as far as how to access those things once we know which groups those are. We've given out more than 1,000 vaccines. We have vaccinated all of our long-term care facilities except for one facility, and that facility, Pacifica, will be vaccinated tomorrow. So those groups have all been taken care of. The healthcare providers have been taken care of. They are starting their second dose of vaccine this week on Thursday, I believe. We are not planning currently in Washington State to stretch out vaccine by not giving the second dose. There's not a whole lot of science behind that yet, and there's not science behind having the dose of Moderna vaccine. So that's not happening currently as far as we know. So my ask to you moving forward is get vaccinated when your turn comes. We need to have a large percentage of people in our community vaccinated to be able to get businesses going again, to be able to get school going again, to be able to get back to what we would consider normal today. So get vaccinated, watch out for your neighbor, stay home when you're ill. So that's a big thing. If you're ill, don't go to work, don't go to school, don't go to preschool, and make sure to be kind to your neighbors. Thanks a lot. Take care.